Are you getting ripped off by your toxin? Are you selecting a provider for Botox, Dysport, Xeomin, or Jeuveau, or Daxxify based on a lowest price per unit point? This is not necessarily the best way to select a provider to inject a neurologic toxin into your face that's going to last and affect the muscles for approximately 3 to 4 months. This can be very dangerous because we now have counterfeit products also coming into the US, even in this city, and they are not effectively regulated. So you could even be potentially getting something dangerous injected into you. Injection of neurotoxin, Botox, Dysport, all of these things is a medical procedure and should be done by a medically trained person who is skilled in this area of anatomy, assessment, and knowledge of product. When you select someone based upon a sale of units and the specific price per unit, then you are subjecting yourself to several unknowns. First of all, if they have it on sale, it's because they're not in demand or they have counterfeit product. They also may be diluting their Botox more than is necessarily recommended by the company or by current protocols and current techniques. So you have to consider why they are offering it to you at such a low price. Certainly for a lot of clinics, it's a gateway into the clinic for more expensive procedures and sales. There is also the marketing fact that whenever you offer per unit, you can say it's $10 a unit, $9 a unit, but then require the patient to be subjected to a much higher dose. So your only true comparison is the skill of the injector and the training of the injector and how often they're doing it, how long they've been doing it, and also your total cost. If you're going in for a Dysport deal that is $4.75 a unit, that sounds like a great price when you're comparing it to $15 per unit of Botox. However, what you're not taking in consideration is you're going to have to multiply that number times 3 to get to a baseline Botox equivalent. In addition to, they may require a minimum amount or inaccurately assess you and just tell you need that much more. So no one really knows what a unit of Botox is, and it's very difficult to actually see the unit because it's not even something you can see in the syringe because it depends on the reconstitution that the injector has done at the clinic. But I can recommend that you go to a full-time injector that is employed or owns a medical practice and be very careful of someone who is offering at a discount or on sale just to get you in the door. And be especially wary of Botox parties and people who are not doing it full-time. This is your face, and this can have important long-term consequences.